Hi, Dr. Talia Marcheggiani here, and today I'm going to talk about thyroid health, a PowerPoint presentation that I created last year, trying to educate people about how a functional medical doctor, naturopathic doctor, approaches low thyroid symptoms. So the thyroid is a butterfly-shaped gland located on the neck right below the Adam's apple. It's an endocrine or hormone gland. Hormones act like messengers. They're chemical messengers produced in different glands in the body that travel through the bloodstream and enter cells and turn genes on. And this results in different proteins being made, and proteins are basically what do all the things that need to be done in our cells. Thyroid hormones produced by the thyroid gland tell our cells to increase our metabolic rate. And this results in us having energy, in burning fat for fuel, in creating heat. How our body takes in food and uses it for energy is our metabolism. And this allows all of our cells and all of our organs to perform their normal functions. Thyroid symptoms are pretty common in North America for a variety of reasons, which I'm going to talk about in this video. The more common thyroid condition is hypothyroidism. This means that the thyroid is not working at its optimal capacity. And symptoms of hypothyroidism are very diverse because thyroid is involved in so many chemical reactions and in improving our metabolism. The symptom can affect every single body system. And the classic symptoms are first fatigue, and this fatigue is expressed as almost like a brain fog and a feeling of fogginess, a feeling of sluggishness and lethargy. People who have hypothyroidism will also feel cold. They'll have problems losing weight, or they'll notice weight gain despite not changing their eating habits. They may actually notice a decrease in appetite, so they're not feeling hungry, and this is reflected in the lowered metabolic rate. The body doesn't need to take in as much fuel. They'll feel cold more often than other people, and this can be expressed as either a low body temperature below 36 degrees, or they'll feel like they need to put sweaters on and have cold hands and feet or poor circulation. They'll also notice dry skin, hair falling out, dry and brittle hair, nails aren't growing as quickly as they should, and even eyebrow thinning is another symptom. Constipation is a very common symptom, as well as menstrual irregularities, because thyroid hormones also control our fertility. If you think about it, when our body is downgrading our metabolic rate, we're not going to be devoting precious resources to fertility. If we're in a state of stress or starvation, which are some causes of low thyroid function, our body is not going to dedicate precious resources to fertility and to bring a baby into a world where there are saber-toothed tigers and food scarcity. A common cause of infertility is hypothyroidism or sluggish thyroid function, suboptimal thyroid function. Women with low thyroid function will also experience heavy periods or regular periods, or they may notice that their periods disappear altogether. They may have issues with ovarian cysts. Other symptoms are feeling puffy, retaining water, and even increased cholesterol. So how do you find out if a low thyroid function is causing these symptoms? Because these symptoms can also be explained by several other things, and it's often easy to point to low thyroid function if we're having trouble losing weight or if we're having issues with fertility. So how we diagnose hypothyroidism is through lab tests. Your medical doctor will probably order a lab test called TSH, or thyroid stimulating hormone. This is a hormone produced by the brain that tells the thyroid how to function. High TSH means that the thyroid is often not responding or is resistant to the brain's control. Low TSH means that the thyroid is functioning either optimally or above optimal rate. So you may be entering a hyperthyroid condition. TSH doesn't test how the actual thyroid is functioning. It's not related to the actual thyroid gland, but is raised or lowered due to a negative feedback loop. So when the thyroid is functioning well, TSH is low because the brain doesn't need to stimulate it to work. If the thyroid is sluggish, TSH will rise because the brain is trying to incite the thyroid to produce more thyroid hormones. This is what we often test in conventional medicine. This is a screening tool, And it's often not accurate, or it can result in a lot of false negatives. So people that have sluggish thyroid function may not have an abnormal TSH or a high TSH. TSH is also used when someone is put on thyroid medications such as Synthroid, and that's used to evaluate if Synthroid is working, if it brings TSH back into the normal range. The problem I have with TSH is that it's not directly assessing thyroid function. It's not separating low thyroid function due to issues with the thyroid gland itself versus autoimmune thyroid issues. And it also has a very broad reference range. So the reference range for TSH is about 0.5 to 4. And as a naturopathic doctor, I like to see TSH under 2.5. A TSH of over 2.5 for me warrants further investigation. Further investigation involves looking at the actual thyroid hormones themselves, T3 and T4. These are the main thyroid hormones. And it's a tyrosine molecule, which is an amino acid bound to iodine molecules. These are the actual hormones that get sent through the bloodstream to target cells and tell them to turn on and off genes to create the proteins that increase their metabolism. So it's T3 and T4 that are actually telling us what our metabolic rate is and how well our thyroid is functioning. These aren't often tested because they can fluctuate, and so we don't think that they're a reliable measure as a screening device. And it could also be expensive to do tons of tests, which is why medical doctors will order TSH first, and if that's abnormal, then they'll order T3 and T4. If I see TSH outside the optimal range, then I may order T3 and T4. Or if I'm working with a patient who has a known hypothyroid disorder or is exhibiting a host of hypothyroid symptoms, we'll order T3 and T4. And other tests that are essential to test for if someone has low functioning thyroid are the anti-thyroid antibodies. So these are the anti-thyroid globulin antibody and the anti-thyroid peroxidase antibody, or anti-TPO, and anti-TG antibodies. And these are assessing whether the hypothyroidism is due to an autoimmune condition called Hashimoto's thyroiditis, which is the cause of 80% of low thyroid conditions. So it's essential to test because the mechanism of disease and the treatment goals are different. If somebody has low thyroid function in the absence of anti-thyroid antibodies, then our treatment goals are to look at the actual thyroid gland itself and to figure out why it's not producing thyroid hormones at an efficient rate. And if the antibodies are high, then we need to assess why the body is attacking itself, because what is happening in this autoimmune condition is that the body is creating antibodies that are attacking its own tissue, and in this case, thyroid tissue. So it's not really an issue with the thyroid itself, it's an issue with inflammation in autoimmunity, and that's what we have to target with treatment. So figuring out and separating the two is essential for figuring out how to treat. Another thing to test for is reverse T3. So in a state of stress, the body will produce reverse T3 as a way to conserve metabolism. So a state of stress or a state of starvation. And so a lot of the time people will have a normal TSH, may have experience with low calorie dieting or high stress, and will have low T3. This is called euthyroid 6 syndrome. In this case, the body is taking T4, one of the thyroid hormones, and converting it instead of into T3 into reverse T3. And this is slowing down metabolic rate and causing issues that I described above with hypothyroidism. So in naturopathic medicine and functional medicine, we treat our patients, not our disease. And this means that we're looking at your symptoms and believing them, because what will happen is people will present with hypothyroid symptoms and not necessarily have low markers in their lab tests, which is why we order a more complete lab test history to figure out what's going on in the body and to really assess what the body's functioning is, as opposed to whether you fit into a disease category. And this is why I talk about having an optimal TSH of under 2.5 as opposed to fitting in the wide normal range of TSH. So just because there's an absence of disease doesn't mean that you're experiencing your optimal state of health. And this is an important distinction to make, and one that I think is essential to the philosophy of functional medicine and naturopathic medicine. Just because you're not sick and don't have a diagnosis doesn't mean that there's nothing going on. And what really irks me is when people are experiencing all of the symptoms of hypothyroidism, their TSH is off, they've got low T3 and low T4, and perhaps the presence of thyroid antibodies, but because their TSH isn't high enough to warrant a hypothyroid diagnosis, they're left alone and untreated while we wait for the disease to get worse. So this for me is unacceptable, because I believe we all deserve abundant and perfect health, and if there are things that we can do in the meantime besides twiddling our thumbs, I think we should do them. So what are some of the causes of low thyroid function? And so the first one, so I want to address the autoimmune thyroid issues, and I'll tell my patients this: it's not your thyroid that's not working, it's that your body is mounting an immune response against the thyroid, and that's what we have to treat. And there's a connection in the literature between celiac disease or non-celiac gluten sensitivity, which casts a wider net and includes people that have an issue with gluten or certain grains, but don't have the antibodies for celiac. With celiac disease affects 1% of the population, but non-celiac gluten sensitivity, it's estimated, could affect maybe 30 to 40% of the population. And there's certain mechanisms behind this. And there's also some evidence that gluten causes inflammation in the digestive tract in every single person, and that just some of us escape the symptoms of it more than others. So because it's relatively easy, depending on what patients are willing to do, to take out gluten for a few weeks and see if that improves symptoms, especially if there are gut symptoms present, that's something that I'll talk to my patients about. So we'll take out gluten and we'll add it back in after 4 weeks to see how that changes symptom functioning. When it comes to autoimmunity, we're always looking at gut health, because 90% of our immune system is in our gut, and that's where we take in foreign objects, such as food, hopefully just food, and our immune cells in the gut show it to the rest of our immune system and tell it whether to attack these foreign particles or whether to use them as food or whether to ignore them. When there's autoimmunity present, the body is out of whack, and it's attacking food particles or cell particles. So there was a study that showed that antibodies against gluten are similar to the antibodies in Hashimoto's thyroiditis that are attacking the thyroid gland. This is called a cross reaction, where the same antibodies that seek out gluten to attack it, thinking that it's a foreign invader, are also now after the thyroid gland. So oftentimes taking out gluten for a month to 3 can help resolve symptoms and keep antithyroid antibodies low. I'll also run perhaps an IgG food sensitivity test to look at what other foods the body may be mounting a response to. If there's an immune response against a lot of foods, this could indicate leaky gut, in which the digestive tract is letting in whole food particles that shouldn't get in, which is causing inflammation and causing perhaps autoimmunity in this case. So that brings us to leaky gut. So our intestine wants to prevent foreign objects from getting into our bloodstream. It really tightly controls what it allows to enter, and it has a really important job to do, because it's got to bring in the things that we eat and put them in our bloodstream so that we can use that as fuel and to repair cells and to have all our enzymes working properly. But it's got to decide what's food and what is bacteria or viruses or funguses or parasites, and keep those out. At the same time, it's got to sample some of those bacteria and viruses and parasite and fungi, and it has to show it to the immune system so that if by the odd chance that those things do get into our bloodstream, we can attack them and get rid of them and not die. And when there's a leaky gut situation happening, a lot of things are being allowed into the bloodstream that shouldn't get past our gut barrier. And this often results in inflammation, especially in an increase in IgG antibodies. And as I spoke about before, these IgG antibodies can start to attack the thyroid gland. By restoring the gut to better health, we're also lowering inflammation and lowering autoimmunity. Healing the gut involves removing foods that may be an issue, that we're mounting an immune reaction against, such as gluten, sometimes dairy, sometimes eggs, sometimes soy. It could be anything, and so I'll give people the choice of doing an elimination diet or ordering a blood test, which isn't a perfect test because our immune system is more complex than simple IgG antibodies, which is what the food sensitivity tests look for. However, it's a good place to start if we're trying to figure out what foods we want to eliminate. And some people will benefit from doing a really strict elimination diet where we just focus on basically eating meat and leafy green vegetables and maybe some fruits, and then slowly add in foods that we're suspicious about to see if that worsens symptoms or mounts an immune response. So there's different ways to approach this, and this is something I'll work on individually with patients depending on their preferences and needs and what their diet is like, because you're often not sensitive to a food that you have very rarely. It's often a food that you have on a regular basis, which is why those of us who eat the SAD diet, the standard American diet, often have reactions to gluten and dairy because we just have them so often. Another thing to address is dysbiosis of the gut. This is a really common condition that we see in North America, and the causes of this are diverse. It can be alcohol abuse or binge drinking, stress, antibiotic use, oral contraceptive use, and other medications, the lack of prebiotic fibers, and a high sugar diet, which tends to feed pathogenic bacteria and starve out the good bacteria. So one of our goals is to kill the pathogenic bacteria using a variety of herbs and functional foods, and to feed the good bacteria or replace the gut bacteria with good bacteria, either with a probiotic or healthy fermented foods. And to restore leaky gut by using some nutritional supplements as well. We have 5 trillion bacteria in our guts, about 10 times the amount of cells that we have in our human bodies. So we're more bacteria than we are human, if you look at it that way, on a cell-to-cell basis. We don't know much about these gut bacteria, but research is focusing more in this area to see how it affects our health and functioning. And we know that some of these gut bacteria actually produce hormones and neurotransmitters that the body uses. When we have an off balance, or if we're experiencing a dysbiosis, this can also affect hormone functioning, as well as affect autoimmunity and the immune response. It's a very complex science that we're learning more and more about. And so one thing that I would recommend while we're waiting for science to catch up is to restore our gut bacteria and follow what hunter-gatherer populations tend to do, which is eat fermented foods and a diet that's high in beneficial fibers that feed the healthy gut bacteria, and avoid antibiotic use if possible. So this means not taking antibiotics for a cold. Obviously, antibiotics are a life-saving remedy for bacterial infections and have increased longevity, but when we overuse them, we can develop resistance, and we can also affect our gut bacteria, leading to problems down the line. And so really being cautious and selective about when to use antibiotics and talking to your doctor is one of my recommendations. Another cause of hypothyroidism are environmental toxins. So our thyroid is very susceptible to any inflammation in the body. It's kind of like the canary in the coal mine, and whenever a patient comes in a state of inflammation, it's very common for them to also have issues with their thyroid. So addressing that inflammation is essential, and addressing that toxicity. We live in an environment and in a culture where we're exposed to lots of toxins. Even if we're in a rural, natural setting, we've still increased the toxic burden in our bodies through our drinking water, through our air, through the foods that we eat, through body care products and cleaning products, to name a few, as well as paints and solvents and off-gassing from furnitures, flame retardants. It's really difficult to completely eliminate the toxins from your environment, but the best we can do is, when we know that we're exposed to toxins, trying to find a toxic-free solution, such as making your own body care products or choosing natural ones, cleaning with vinegar and baking soda as opposed to chemical cleaners, and filling your house with plants like spider plants, Boston ivy, and ferns, which tend to detoxify the air, as well as doing twice-yearly detoxes by supporting liver, kidney, and colon health, and ensuring that you're pooping on a regular basis, which is another way that we eliminate toxins. So with my patients, I'll talk about how to detoxify, how to avoid exposure to toxins, and what toxins they might be exposed to on a daily basis, and try to eliminate that toxic burden, as well as increase the body's capacity to eliminate those toxins, because our body is very good at getting rid of toxins, but sometimes it's overburdened and needs a little bit of help. So another cause of low thyroid function is stress. So stress can contribute to Hashimoto's, autoimmune thyroiditis, and it can also contribute to something called, that I mentioned before, euthyroid 6 syndrome, in which our thyroid is making something called reverse T3, which is not performing the normal functions of T3, a thyroid hormone, and therefore slowing our metabolic rate down. This happens due to stress, because if you think about it, stress is a condition in which we start to conserve because our body thinks that there's danger around. And one of the biggest causes of this is starvation. And I say starvation not to mean zero food, but low calorie dieting. So anytime there's caloric restriction, our thyroid is pretty quick to slow metabolic rate. This may be caloric restriction that's only with a deficit of 500 kilocalories a day, which is a normal 1 pound a week weight loss diet. And so really being careful about low calorie dieting and definitely avoiding crash dieting and starvation diets and trying to lose weight quickly is an important thing to do to conserve thyroid function. And a lot of the time people in this state will notice that when they increase their calories, especially their fat and protein, that they'll actually lose weight more quickly, even though they're eating more. What happens is we make reverse T3 and our body starts to conserve, sometimes reducing its caloric output by about 300 kilocalories a day. So this is going to be a situation where somebody is eating a low calorie diet and not losing weight or still gaining. During stress, our body has problems converting T4, a thyroid hormone, into its active form, T3. So this will be cortisol, the stress hormone, will lower that conversion rate, and that's simply to conserve energy and focus on getting us away from danger, which is what the body thinks is happening when it's under chronic stress. Also, tyrosine, the amino acid that makes thyroid hormones, is shunted to epinephrine and norepinephrine. If we have an increased demand for epinephrine and norepinephrine because perhaps we're anxious or stressed out, or our body is no longer responding to cortisol and therefore needs to make catecholamines, epinephrine, norepinephrine, in order to maintain its sympathetic tone, then we're not going to be making as much thyroid hormone. Stress is also a cause of autoimmunity, dysbiosis, leaky gut, perhaps food sensitivities. So stress is another mechanism through which we might enter the autoimmune hypothyroid pathway. Another cause of hypothyroidism is straight up nutrient deficiency. So a very common one was, in the presence of a goiter, was iodine deficiency. We tend to not be iodine deficient in North America simply because iodine was added to table salt. But since a lot of us are eating sea salt or other kinds of salt that aren't iodized, iodine deficiency is becoming more and more common. However, supplementing with iodine can also impair thyroid function. So you have to be very careful about how you get iodine into your diet and whether or not to supplement. Soil depletion is another reason why we may have low iodine. Other signs that iodine may be low are infertility, because the oocytes, the ovary cells, also need iodine to function properly. I already mentioned that low protein may result in low thyroid function simply because we're not getting enough of the amino acid tyrosine, or stress, where we're shunting tyrosine to make catecholamines like epinephrine, norepinephrine. Selenium is important for the conversion of T4 to T3, and our thyroid needs selenium to function optimally. And because of soil depletion, a lot of us are deficient in selenium. Selenium also helps us make an antioxidant that our body uses to neutralize free radicals. The thyroid also needs zinc and iron to function properly, which are often deficient in vegetarians and women that menstruate heavily. And finally, inflammation, which I've already touched on by addressing other potential causes of low thyroid function. So inflammation will be caused by a variety of things. Inflammation is not necessarily a root cause, because if there's the presence of inflammation, we need to look for how the gut is functioning, whether there's a dysbiosis happening, whether leaky gut is present, whether the person is under stress. When under chronic stress, the brain stops responding to cortisol, an anti-inflammatory stress hormone, and inflammation begins to ensue. It's like a cortisol resistance similar to what a type 2 diabetic might experience with insulin resistance. It's been shown that the hypothalamus becomes insensitive to cortisol when cortisol is present far more often and in far higher amounts than normal. I find that with Hashimoto's thyroiditis, one of our key treatment goals is to bring down inflammation as well as addressing its underlying cause. Oftentimes, omega-3 fatty acid and vitamin D3 deficiencies can result in inflammation and autoimmune thyroiditis. So there's more and more studies that you can check out on PubMed. If you do a search for vitamin D autoimmune conditions, you're going to find a lot of citations in which low vitamin D can contribute to autoimmunity and also low immune function. So vitamin D is a hormone that is present in thousands of chemical reactions in our body. About 70% of Americans are vitamin D deficient. I can only assume that number is much higher for Canadians because we're even farther north. We're exposed to natural sunlight on a far lower basis, and then when we do get sunlight, we tend to put sunscreen on to protect our skin from skin cancer. Our skin makes vitamin D in the presence of UVB light, which is what we tend to block out to avoid aging, to avoid skin cancer, and to avoid sunburns. And we can get some vitamin D from food, but definitely not the amount that we need. So asking your doctor for a vitamin D test is useful. Or supplementing with vitamin D. Omega-3 fatty acids from marine sources, such as fatty fish, are high in EPA and DHA. These are not essential fatty acids. Our body can make them, but it chooses not to make them, or it often has impaired ability to make them. And so supplementing to lower inflammation is very important. In other videos, I've talked about how our omega-3 to omega-6 ratio is low in North America because of the standard American diet, in which we get a high amount of industrial seed oils like canola oil and corn oil and safflower oil. These are all cheap, genetically modified oils produced in large quantities that contain a high amount of omega-6 fatty acids, which tend to promote inflammatory pathways. Our hunter-gatherer ancestors, it's purported, had a 1-to-1 ratio of omega-6 to omega-3 fatty acids. And this is because they consumed meats that were grass-fed and probably more fatty fish. So you can either eat more fatty fish or supplement with a high EPA fish oil to bring down inflammation. So that's my presentation on hypothyroidism. So some key points to take home are looking at the cause and doing a proper assessment through proper blood tests, and also taking symptoms seriously and finding a doctor that takes your symptoms seriously, doesn't just brush you off and tell you that everything's normal when you're experiencing low thyroid function. This happened to me when I was in undergrad, and it's one of the things that brought me to naturopathic medicine, was this tendency for naturopathic doctors and functional doctors to look at how body is functioning, not whether or not it fits into a disease category while an underlying disease process is happening. We also want to address inflammation in general and look at the causes that thyroid may be functioning improperly. And this involves dividing up thyroid symptoms into autoimmune or non-autoimmune conditions.